What's up, guys? My name is Omar, aka Daher Radiology. I'm a radiology resident, and today we're going to talk about a question that a lot of people were asking me: what is the radiology lifestyle? So let's get started. Alright, so today we're going to talk about the radiology lifestyle. A lot of people have been asking me this question and specifics about what a day in the life of a radiologist is like. I know a lot of people who go into medicine these days are thinking about the lifestyle that their specialty might offer when making a decision, so I know this is a very requested topic. I just came back from a rotation on interventional radiology, and I'm going to talk to you today about mainly diagnostic radiology, but a little bit about interventional radiology as well. And we're going to go through all aspects of the job. So let's get started with the day-to-day work. So remember that everything that we talk about today definitely depends on where you work and also what system you work in. So everything that I'm talking to you about is about a North American system, specifically within Canada, because that's what I know and that's where I'll be practicing. So if you're from the States or from the UK or from Europe or from Australia, these specific systems vary quite significantly, especially the lifestyle, the work-life balance, the amount of money you make. All of these things vary. So take everything with a grain of salt, but I'll try and talk about general things and then specific things related to the Canadian system. Right, so today we're going to start off by talking about the workday. So radiology kind of depends on if you're going to be working in the academic centers or in the community. And so what that means is an academic center is usually a tertiary center where it's a bigger hospital and a lot of education happens in these centers. So where there's a radiology residency, there's residents around, there's medical students around, a lot of teaching and a lot of research happens. So if there's a big city, for example, they usually have a big hospital that's a tertiary center, sometimes multiple hospitals. This is called academic radiology. So if you work at one of these institutions, your day-to-day work is very different than someone who works in the community. And what the community means is that you could be at a hospital that's in a smaller town or city or even, rural, remote places, that you service still a whole bunch of communities. However, your work is much more clinical oriented. So you're doing a lot more radiology related work as opposed to teaching and research for that matter. So right off the bat, if you're going to be an academic radiologist, you're going to start your day off in the morning. You're going to come into work. Now, what time you come into work definitely varies on where you work. But a lot of radiologists, will start their day at 7 or 8 or 9 a.m. And they'll come in. They'll have, of course, their own office space or desk space, because radiology is all dependent on your workstation. So where you're going to be reading your cases and dictating your reports. Usually you have a nice workstation, like here, for example, I have my desk. I have a couple of monitors that you would have set up. You have a dictation device, a dictaphone, usually that registers your speech right into a report that's on one of your screens. So you come into the morning, and on that day you may be assigned to specific type of imaging workload. So for example, you might be on ultrasound that day, where you're going to be dictating all the ultrasound studies that come in, and if there's any problems, you might have to troubleshoot with ultrasound techs in the hospital. So you come in and, a lot of radiologists will have their cup of morning coffee, their whatever preferred drink. They'll come to their desk, they'll set up. A lot of them will put their own music on, kind of get in the zone, answer emails, just like any other job. So when you start your day in radiology, you're initially potentially front-loaded. So all of the studies or scans that were from overnight, especially if you're in an academic hospital, you may have had the resident that was on call on the previous day, having read a whole bunch of studies and sent them to you as a preliminary report. So you go through those cases and you basically agree or disagree and change the report, and then you sign off those reports from the day before, and then you can start on your current day's work. So once you start on your current day's work, you're responsible for anything that gets scanned that day. So all the ultrasound techs are going to be in the department scanning patients, inpatients, outpatients, emergency room patients. So there's a big variety of cases that'll come in. If something comes in as a stat examination, it's usually something that needs to be read pretty quickly, usually said to be within the time frame of an hour. That can vary for different institutions. But of course, those ones take precedent, and then everything else that's an outpatient or as an inpatient exam kind of depends on the level of severity. So that being said, you start reporting your list, and you try and get through your list and keep a steady pace so that you're keeping up with the turnover time. During that process, you're in your desk, and all the clinical teams are also starting their day, and they may have questions or want a opinion on a particular case. So they may come knocking on your door and interrupt your workflow and ask you a certain question, like, hey, we have a 50-year-old female patient with abdominal pain in the right upper quadrant. What do you suggest? And you are the expert in imaging, so basically you're going to provide some information for them based on the clinical picture, what you think is best, and protocol that study, and then have that as future work for you that day or the next day. So while you're working through your cases, in an academic hospital, you may also be responsible for teaching a resident during the day. So if you're a body radiologist, that would be someone who does abdo and chest CTs, ultrasounds, MRIs, etc. You may be responsible for a resident as well. So the resident might come in the morning and say, hey, can I read from your list? And then we would review with that resident at another later time during that day and teach around those cases as well. So far you've had your own work list, your residents, academic teaching, as well as the clinical teams interrupting you. Then it comes in around lunchtime, and some academic hospitals have rounds as well, where they'll attend either a teaching session for the residents or case reviews of particular hard cases, or even M&M reviews of missed morbidity and mortality cases, what we can do better in the department. Those are usually interactive between different parties, whether it's a clinical team or your ultrasound techs or your x-ray techs, CT techs, or the residents themselves, and you kind of play an active role in leading those rounds and helping others in those clinical decisions. So then you're continuing your day. You're probably tired by this point. You might take your desk and make it standing as opposed to sitting and continue doing your reading. And there may be a difficult ultrasound case that day that may require you to actually go and see the patient and ultrasound live in the room with the patient and the tech, because the tech might come to you and say, hey, I see this thing, in the abdomen. I don't really know what it is. Do you mind come taking a look? And you go as the radiologist and take a look at it and get a feel of what's going on. So if you have any further questions, you can ask the tech to do further manipulations, etc., etc. And so it's a lot of troubleshooting in that sense as well. Now, at the same time, you may be responsible for procedures as well. So in the hospital, especially in a tertiary center, many procedures are image guided, and that may require using ultrasound or CT to guide a procedure. So for example, if you are on ultrasound that day, you may be asked to do a paracentesis, where you're taking the fluid out of the abdominal cavity under ultrasound. So instead of just poking a needle in someone's belly and trying to take the fluid out, you're going to use an ultrasound probe, and you're going to use a needle, and you're going to follow that needle into the abdomen and take out that fluid. So that may interrupt your day because you may have multiple procedures booked. And it's a service that you provide for the clinical teams, because a patient on the medicine unit or the surgical unit may not be able to get that procedure done because they can't go to the OR, for example. So then they get sent to you. And this is called an intervention or an interventional procedure. Now, this is for a non-interventional radiologist. They still do interventional procedures. So that breaks up your day as well, and you go and do that procedure. When you get those images, they come to you as well, and then you report them. So it's a combination of both reporting and clinical procedures during your day, on top of academics, which is resident-based or rounds-based. And then by the time the end of day comes, you're hopefully caught up on all your studies. If not, then you're maybe staying a little bit longer. You're trying to finish up your work for that day. Or some people go home and report from their home stations as well the work that was done that day, just so that they're not falling behind the next day. Now, there's also within tertiary centers things called tumor boards, for example, or interdisciplinary rounds, where multiple different physicians come to these rounds and bring hard cases or cancer cases, etc., and you play an active role in those as well. So for example, there may be a cancer that's unknown. Surgeon's trying to think, is this resectable by surgery? The radiation oncologist is asking if there's radiation to be played a part of. The onc medicine person is asking about chemo, and you're there to guide kind of the imaging aspects of the case. And it's another discussion. So you have to get ready for those, you have to prepare those cases, and you have to know them to present at those tumor boards, usually early in the morning or in the afternoon or at the end of the workday. So that kind of sums up what you do in the work day, going over education, teaching, work lists, procedures, tumor boards. All of these things are something that a radiologist does in their average day, and this is definitely dependent on what you're doing for that day or what your subspecialty is, whether you're a neuroradiologist or a musculoskeletal radiologist or a body radiologist. They definitely vary in that sense. Another aspect of the day that I thought is important is taking breaks and kind of what breaks down your day to make it a little bit less difficult. So in radiology, obviously you're not waiting for the OR or to do a procedure at all times. A lot of the time you're actually working at your desk, so you can have yourself your nice coffee, you can have the music playing in the background, you can work at your own kind of discretion and comfort during the day. So in terms of having breaks, you can kind of take them at any time, so long as there's no stat exams that need to be read, or if you're caught up, you can kind of work at your own pace because the other exams don't really have a time limit on them. So basically your work day isn't as stressful as some of the other clinical medicine days where they have a patient that is actively bleeding and need to, do X, Y, and Z so that they stop or prevent them from getting sicker. So basically, what I'm trying to say here is that in radiology, it's very kind of at your own pace depending on what you're doing for that day. And it's really helpful to know that as long as you're keeping up with your work and you're getting the procedures done and your work list is manageable, that you can kind of work at your own pace and take breaks whenever you want. So a lot of medicine is about what you do during the day and what you take home. So for example, in family medicine, there's a lot of take-home work that happens. So when you see the doctor in the, clinical practice, you see them for 15-20 minutes and you tell them all of your concerns, and they tell you that they're going to refer you to this doctor, they're going to do this blood work, and they're going to give you this medication, etc., etc. So some of that work actually comes back to them when they're not seeing patients, right? So they have to review the lab work, they have to see what they ordered in terms of imaging, for example, and they have to follow up with a lot of stuff. Now this work here is what we call take-home work, because most of that time it's after-hour work that is kind of piled up but is something that you need to do as a family physician. In radiology, it's kind of nice that when you open a case, you read out that case, you write a report, and then it's done. It's over and you move on. There's no real attachment to it unless you're doing a procedure, for example. Maybe you have to follow up on that patient the next day, how they're doing, and follow up on some blood work. But for the most part, in radiology, when you finish your work, you can go home and definitely not worry about what you have left or what the work you did that previous day. Which is definitely a pro, because it's kind of peace of mind that when you're off, as long as you've finished your work and there's nothing pending and there's no, leftover scans that you haven't read, you can pretty much be off and focus on what you're doing during, your time off, whether it's vacationing or traveling or whatever it is. Speaking about time off and vacations, radiology has a definite pro when it comes to taking time off and vacationing, especially in a world where medicine is a very demanding work environment. So in radiology, at least in Canada, there is a pretty good balance between work and time off. In most centers, we're talking about 8 weeks of vacation time. In some groups that's more, some groups that's less, depending on if you just started or if you're kind of a senior associate in that group. But I would say from my knowledge and from what others have experienced, that 8 weeks is probably around an average time that a radiologist might take off during the year, which, if you think about it, especially in terms of other jobs, I think that's a pretty good balance. You work really hard during the weeks that you're on, but you get quite a bit of time off to kind of recover, to take for your own personal use, and a lot of times that is actually more than what people want off in a year. So in some of those cases, people will actually use their time off to locum in another place. And locuming is when you signed a small contract where it's a very temporary work environment and you go work somewhere and provide a service at another place where they need a radiologist. You get paid for it as well, but in your own time off, so that it's not disrupting your current job. And then people will take less time off in general and obviously add to their income in that sense. But if you don't want to do that, then you can take all of it off and enjoy quite a bit of vacation time throughout the year. What's really nice about the time off in radiology is that you don't really need to have, in family medicine, when you take time off, you need someone to cover for your patients. In radiology, as long as you're working within a group or you're working, within the hospital environment, there's going to be someone who's going to be reading those cases. And so there's no real need to have someone cover for you in that sense, or at least have the worry that your patients are losing their continuity of care, because there will be someone else to read those scans for you. So all in all, this is kind of the summary of what a radiologist's lifestyle is like, from the workday to the teaching and academics to procedures and to time off. It kind of gives you a broad overview, especially if you're looking to think about radiology as a future career. These are some of the things that might interest you or might sway you away from radiology. I hope this was helpful, and as always, if you have any questions or want future questions to be answered on upcoming videos, just leave a comment below or DM me on Instagram. I'd be happy to continue doing these videos if it's helpful for everyone. And again, guys, if you liked it, please click that like button, hit that subscribe button. I do these videos as much as I possibly can, and I hope people are enjoying them. So again, we'll see you next time. Take care.